What is important to know about the nose before rhinoplasty? Let's start with anatomy, and I will explain it quickly and informatively. The first thing you need to know and understand is that there is external and internal nose. During a nose plastic surgery, it's the external nose that undergoes changes, which is the small part of entire nose. What is important in external nose? The most crucial and essential part is the nasal septum. It acts like a load-bearing wall of a building, supporting almost the entire anatomy of the external nose. The nasal septum can consist of cartilaginous tissues or both cartilaginous and bony tissues. It's crucial for the surgeons to know and understand whether the septum is intact before the surgery, if there is any deviation, how much of the septum is ossified, and if there is any deviation or displacement of the septum, especially under the bony part of the nasal dorsum. The nose dorsum is only composed of bone, about 30–40%. As you can see, the majority is made up of cartilage. It's also essential to know and understand that the nasal dorsum, a part of the septum, consists of nasal bones, nasal parts of maxilla bones, the upper lateral cartilages here. So, when we talk about nasal deviations or crooked noses, it includes all the nose structures. To straighten the nose, it's not enough to just correct the septum. All the over-mentioned structures need to be addressed as well. All of these structures, their symmetry, position and sizes are analyzed through computer tomography. Watch my video about computer tomography to learn how to read and understand it correctly. The tip of the nose consists of two cartilages in everyone. The thinner the skin, the more visible and noticeable they are. They're attached to the septum with ligaments, which also determine the elasticity of the nose tip. Earlier, ligaments were described as contributing to the elasticity of the nose, but in 2023, Carlos Neves presented new nose anatomy and showed that such ligaments do not exist. To know and understand the thickness of the skin, the position of cartilages, especially the nose tip, it is necessary to perform the sonographic examination of the nose tip. What is the difference between closed and open rhinoplasty? Essentially, it's only the incision on the columella. I performed only closed rhinoplasty because even the slightest visible scar concerns me. Also, in the first 5 years of my practice, I only did open nose surgeries. For the past 7 years, I have been doing closed ones exclusively. It's more challenging as the surgery is performed only through the nostrils, but it's ensured that patients won't have any additional facial scars. While some surgeons may make the incision of columella less noticeable, the risk is lower with closed rhinoplasty. Let me tell you about the differences between piezoplasty, piezo-rhinoplasty of the nose, and other rhinoplasties. Nowadays, these often just serve as marketing terms. For instance, piezo devices and micromotors, other devices are special tools that allows for more precise cutting of the bone. But as you remember, the nose consists only 20–30% of the bone tissue. So these tools don't affect the result of entire operation, but only apply to the stage of the operation when you need to work with the bone. The piezo device allows cutting the bone tissue without damaging the mucosa. Often this helps and is needed during the surgery, but it's important to know and understand that an experienced surgeon can cut the bone without damaging the mucosa, even with standard tools. In my practice, I use all devices: piezo, microsaws, micromotors, and classical tools. I prefer mechanical microsaws, as I can work with both structures, with bony and cartilaginous tissues. But I can even perform surgery with classical tools. It's important for you to choose not the device or technique, but the result, the surgeon, his vision of your future nose. I recently showed in my social network different options for how Hollywood star celebrities could change if they had rhinoplasty. Even with minimal changes, and as you can see, these minimal incorrect changes make strong changes, and this person loses their individuality. Remember that you have only one nose. It is the center of your face. If you are unhappy with the surgery, correction is possible. But returning to the nose, to its original appearance, is very difficult and sometimes even impossible. Therefore, choose the surgeon, his results, his vision of beauty, not the price of the surgery. You can save money, but then this saving will be a problem for the rest of your life. It's better not to have the surgery than to have a bad surgery.